reducing, preventing non-communicable diseases, that is becoming a biggest challenge or one of the biggest challenge for our country. And to make us understand this critical aspect, we will have a host of finest experts from the country. And to host that first session, it's my great pleasure to invite Dr. Prakriti Poddar, who is going to moderate this a very important session, which has a lot of that knowledge and wisdom which we are going to see to how to deal with our growing burden of non-communicable diseases. Dr. Poddar is one of the most passionate ambassador of mental health, and she also believes that mental health is also getting impacted a lot with the kind of food we consume. And she has been consistently striving to spread awareness and sensitivity towards mental health. She is the managing trustee of the Poddar Foundation, which is dedicated to creating a better support system for mental health for all. So with this, welcome Dr. Prakriti Poddar, and then now the floor is over to you with our wonderful speakers for this session.
Thank you so much. Thank you so much for having me on this, and it's a real honor to be with all of the experts on this panel. I think this is such an important topic because India is on fast becoming the capital of NCDs, and I remember when I started the foundation, even though it was a mental health foundation, my first initiative was to curb obesity, and people didn't recognize that obesity was a mental health concern. In fact, when we look at, the entire thing was called OBCs, and it of course didn't take off as well as it should because nutrition was not taken seriously in mental health. But I'm glad that now, policymakers and opinion makers are looking at this as a serious conversation, and it's not just fad diets, but really understanding nutrition and holistic living from the way of eating right, because it is impacting, and clearly research has shown us that it's impacting cardiovascular disease, cancer, chronic respiratory disease, and diabetes, amongst a few, but of course there are many more. And I think let me start first by introducing who we have on the panel, and then we'll break it down into questions for each, and then we'll build on that. So we have with us Dr. Bhavna Sharma, who is the head nutrition science in the ITC Limited. She's also responsible for developing and implementing the scientific and nutritional strategy for the organization, and responsible for product development along with external scientific collaborations. What I loved most is that you are research based, and that's always so important because you've done research in vitamin D and the impact of it, the dietary intake, food consumption, etc., and also the focus on the children, because I think that one of the things that I would love you to highlight is how the nutrition in the first 1,000 days, how that really impacts the NCDs as we go forward. I think that is something that people don't really recognize. So that is going to be asked for you to highlight. Then we have Dr. Preetha with us, who is the Associate Professor of IIHMR in Delhi, and having done her MBBS from the Government Medical College at Trivandrum, the MD of the Community Health Administration and National Institute of Health and Family Welfare in New Delhi. Your work has been rich and diverse across the public and private sector, which again, we know very clearly that we will ask you questions that highlight, what you think about how to really impact change going through the public and private sector. Her professional experience has been there for more than 14 years in the health sector, and the immense exposure in training, research, project program and management. So it's lovely to have you here. We also have with us Dr. Sachin Bajaj, who I have met before on another panel. Welcome again. And he's sort of been the alumnus of prestigious institutions like INSEAD, King's College in London, IIM, Calcutta, PGIMS in Rohtak. And he's right now with the Ujala Cygnus Hospital as a director. He is a qualified medical scholar. After completing his MBBS, from PGMIS. He did a doctorate in internal medicine from the Dr. SN Medical College in Jodhpur. Apart from this, of course, he's a certified professional. He's done a certified professional course on diabetes management and total control from the academy, from the American Academy of Continuing Medical Education in the USA in 2008. So we're very happy to have you here, and looking forward to you sharing your ideas about what really one can do with the dietary controls that will aid our practice of good health. We have with us a columnist and author and a nutritionist as well, Dr. Ishi Khosla. Ms. Ishi Khosla is a practicing clinical nutritionist, which is really important because you're actually, touching the lives of people on an everyday basis. And what I love about your entire repertoire is that you're working with the obesity, diabetes, cardiovascular disease, food allergies, digestive problems, immune system, neuropsychiatric issues, and of course that's going to obviously make me smile, and the endocrine disorders in adults and children. And I would love, I know I might not even ask this question, but if you can rope this in when we're having the conversation about how a lot of the mental health illnesses are being tackled by just gut health. And I think that's something that's really important, and it's not part of our particular conversation right now. So we'll ask, of course, the questions that are relevant, but I'm sure you will have the capacity to draw this in, considering you are a columnist and an author, so you have a way with words. We also have with us Dr. Nikhil Kelkar, the Joint Managing Director of Hexagon Nutrition. Nikhil is a graduate of Naya Hospital in Mumbai, a medical professional dedicated to clinical nutrition. He's responsible for the global clinical nutrition business of Hexagon Nutrition and is instrumental in establishing the Pentasure and Obesijo brand of the company. He has worked for 7 years in New Zealand as a dental surgeon, and from the last 12 years, Nikhil is working as a senior management level at Hexagon. I'd like to welcome all of you. Thank you very much for being here. And we're going to definitely try to understand why India has to really make it a priority to eat right and to live right. So moving on to the agenda, we know that people, even above the age of 55, as they start, the NCD burden has become magnified in our country. It's really time to opine on this, taking into account some of the research in terms of the dietary surveys that have been done, maybe household surveys. I'm not even sure what surveys get done on a policy level, and whether it's an NGO or whether it is the government, but we have some experts who can answer that, so we will move on into that. So Dr. Bhavna Sharma, my first question goes out to you. Non-communicable diseases continue to be an important public health problem in India, and is really responsible for a major proportion of the mortality and morbidity that's taking place currently. This, of course, is compounded by the change in the demographic, lifestyle, as well as just the habits and urbanization. I would love your input on what kind of research supports or, what kind of research highlights some of the burdens and what really compounds this issue, and maybe some of the ideas on how to address this issue.
Yeah, I think first, thanks a lot. I think what we are discussing today, and I think especially to the question that I've been asked, and I probably try my best to do this, because I think this question that you've just posed is something that I think when I was a student, we used to think about it, and we used to think that, probably in the next 10 to 15 years, we are going to be able, to manage it so well that we're going to be in a position that we're going to probably reverse a lot of damage that have been done probably in the last, 3-4 decades. Unfortunately, the situation has improved a bit, but it hasn't improved to the fact that we can say we are very good at it. What you rightly said at this point in time was that NCD, the non-communicable diseases. Today, if you open it up and you'll see India is a capital for diabetes, India is a capital for this. I think for me, when I look at this whole piece, it comes together, in a bit of a side way. today where we are going as a country, where I think if I put the focus on, which is the most vulnerable group that we talk about, which is about the kids, I think one of the things that has always stayed with me is that this whole, the first 1,000 days journey, and how it is actually becomes like a ball that doesn't stop, and it starts becomes a vicious cycle and takes a big chunk of population along with it. And I think if I just have to put one number, because there is a huge amount of statistics that stays across, if I just have to take one number, I would say that, which stuck with me forever, and that has always been the inspiration for the research that I do, especially when it comes to children or pregnant women, which was also the topic that I kind of picked up during my doctorate, was about the fact that, India's stunting problem in the kids, it represents the largest loss of human potential in any country in the human history. This is something that I think the term that some of us will be familiar with is something we call as Indian enigma. So if I just to take that example ahead, I think probably 5 years back, we used to say that, we have 20 times more percent of children under 5 who are underweight in India than how it actually should have been, given the resources, given the policies that we are working together. And in the same breath, 9 times percent of children under 5 who are probably wasted in India as compared to what it should have been because of the predictions. And if you actually say that, almost all wasted children that we talk about in the world are actually living in probably Asia and Africa only. And half of all stunted children under 5, are actually again in Asia, and more than 1/3 in Africa. So what I'm saying is I don't want to throw data, but when it actually comes down to be, the truth is that today we are at a place, and I think we recently saw the NNMB data, which has also come, the UNICEF data, which has also come for kids, and adolescents. Those figures are quite heartbreaking. So when it comes to that, it actually says that we cannot shy away from the demographics that are sitting with us. If you see those numbers, where we actually have, kids, or pre-adolescents who are now who are actually diabetic and have high cholesterols. So that is a number that we all together need to work at. So, this is about the stats part of it. When you actually say about research or the kind of interventions or what are the kind of things that should be done or can be done, I think, like I said, this is not something that just an industry body or just the government or just, NGOs or independent experts can do. I think one thing that always comes together when we all actually sit down to discuss is that is a very, very complex, interconnected situation that we have here. It is not only about, and I think what our Prime Minister Modi just said, in his speech a few days back, is to say that even when it comes to food, it's not only about the kind of food that we eat. It's about how much we eat, the frequency and the amounts of the consumption of the food, which has a direct bearing on the NCDs, which is impacting the country today, and it is also causing the economic loss, to the country today. So actually, when you see, I think all of us have a very unique and a distinct role to play into this thing. There has to be significant amount of statistics, significant amount of epidemiological data set that needs to be put in. And I think in a country like India, where we have our own unique challenges when it comes to gender, when it comes to kind of food availability, the food security, and like we said, accessibility and affordability plays a very big role. That number, that data has to be presented. I think somewhere down the line, we also realize that as a country, we are pretty much sometimes good at having data, but the application of data in order to convert it into policies, whether that policy comes about, including certain things into the midday meals or the Anganwadi support system that works onto that, or it actually goes to the fact of changing the policies on how food is handled, manufactured, processed, which is about the food waste of it, but also about which goes to the self-regulatory and the self-responsibility for the industry in order to come out and work in a responsible way when it communicates to the consumers eventually to talk about the good part of it and also take responsibility at the core of it to, not be part of the problem only, but actually also start to come on to solutions. And I think the real answer goes down to 2 words for me: honest research and credible policies. If these 2 things are taken care of, I think a lot of stuff can be handled very well together. That's my first thought actually on this.
Thank you so much. That's great. Honest research and what was the second point? Honest research and implementation. And the policy implication, the policy implementations in the most sincere.
where it matters the most, because I think there is no dearth. Like when I look back, I think 15 years back I could have said that, I used to be part of forums where I would say we don't have data, we don't probably know how to do it, let's look at the other countries how they are doing. Today I'm telling, we have the data, we have the intent, we have the muscle. We just have to put these two things together, the honest research, and I think there is huge amount of sincere research which is happening in different pockets to bring it together under a theme which is, I think, happening now as we see in the last few months and years, and convert it into application, either in terms of policies which go to industries in terms of communication, which is voluntary and sincere, and the other one goes to the at the higher level, where we, even when we talk about imports or exports, whether we talk about ancient grains, midday meals and all the things. So research and policy, this bridge has to be connected, and I think
that's a very wide bridge, unfortunately. And I hope there are a lot more, there's a lot more done in this space, but that's important. Thank you very much. I'm going to move on to Dr. Preetha. Having worked across private and public sector, and we've heard about the bridge that we need to cross and navigate at this point, I think you can also highlight, going forward, how we can do that. I think one of the things that we're really talking about is this misalignment that we're beginning to see in the knowledge, but the lack of implementation and actually following through with even the knowledge that's being shared. I think even just in the videos that were playing before that, there was a lady talking about how you should allow your children to eat as much as they want intuitively, and they will know how much they need. And I think that on every table that I have ever sat on, I see a mother telling the child that the child doesn't know that they're full and they should eat some more. And then they complain about the child having put on weight and not being active enough. It's a double-edged sword. But not only talking about that, I think I definitely think policy is one thing, but change has to start in our own homes as well. But let's talk about the policy level and talk about how do we actually manage this disease burden caused by this dietary misalignment. Dr. Preetha.
Thank you so much. Let me thank you first. And as we all know, non-communicable diseases are so complex that the causes and the solutions do not lie just in the health sector. They are like spread across a number of disciplines. It's everywhere. So it is not just the health sector who has to work on it. All the departments, multiple departments, multiple sectors have to sort of come together. I've definitely worked in the private sector, but as of now, I think more like an academician. There's a lot of interest in the academic circles also about non-communicable diseases. You take the risk factors, nutritional transition, of course, along with the demographic transition as well as the epidemiological transition. It stands shoulder to shoulder with both of them in the causation of non-communicable diseases. And along with tobacco use or harmful use of alcohol, nutritional risk factors, improper eating habits, as a behavioral risk factor, along with a lack of physical activity, are major implicators for most of the non-communicable diseases. A lot of work needs to be done across sectors. I agree with the previous sector that there is a lot of data, definitely. But to convert the evidence into practice, we definitely need more information across sectors, different settings. We should think when we think about when we just take the nutritional dietary risk factors, to think that it starts at birth, even before, and I'm just parking it aside, to think that a baby who's breastfed, who is timely complementary fed, has a lower chance of obesity and lesser chance of having non-communicable diseases in life. There are so many other dietary risk factors. Have we done assessments? Have we done enough assessments? I really doubt. The latest WHO campaign is about eliminating trans fat from industrial settings. So there's a lot of work to do, for which the public and private sector can come together. The gamut of care is also so comprehensive that primordial prevention, the term diseases, the care that has to be provided to the population. The population needs are also so diverse that we have to take care of their promotive health needs, their preventive, primary prevention health needs. Curative aspect is also very important. There is always a tendency to sort of, undermine that part, clinicians. No, it's very important. The curative part is very important. The rehabilitative part is also important. So there's a lot of work which has to be done for us to enable evidence generation and to convert it into practice. As an academician, I teach. We have a lot of students. Then we do research, we do training. So I think in teaching also, it's a wonderful opportunity to sort of sensitize an entire generation of students about the importance of preventing, managing, and managing non-communicable diseases. There is a lot of scope for research, not just assessments, but also hand-holding systems to implement. In the sense that implementation research has a lot of scope. There's a lot of opportunity, and academicians are generally very interested to be part of that implementation research setting, where we work together with the healthcare delivery system. Academicians would only be on the sidelines, would just be monitoring, but the health providers themselves, so the members of the healthcare delivery system, would be implementing the solutions. So I again agree with the earlier speaker who said, it's not just about problems, it's also about solutions. So a lot of information has to be generated. Multiple sectors have to come together. Many departments have to come together. The social determinants of health, it's most important when we speak about non-communicable diseases. When we have these 4 risk factors and air pollution in Asia as the tobacco, lack of physical activity, nutritional factors, harmful use of alcohol, and air pollution. But we cannot forget the social determinants. And many experts say that these social determinants may be more important causative agents than the risk factors per se. So it is important that we have a very holistic approach. We involve multiple sectors, the different departments, and come together, do a comprehensive, have a comprehensive research plan, a teaching plan, inculcate into the curriculum, build healthy eating habits, right from very early childhood. So schools have an important role to play. The evidence can be shared with them, and it can be sort of built into the policies, and not in just health policy. This aspect has to come in all policies. Health is a very important priority, should be a very important priority. It should come into all policies. A lot of work can be done through research, training, teaching, advocacy, involving many sectors, and generate evidence and convert them into policy.
Thank you so much. I think you've touched on some really important points. I know at Podar Wellness, which is my company, we actually do preventive healthcare and not curative. And in that, our 5 verticals, the first vertical is mindset, and the second vertical is nutrition. So it's mindset, nutrition, physical fitness, recovery, and the last one is financial well-being. And when all these verticals are in place, you are in good health. And nutrition, like you're saying as well, and I think Bhavna has also said before this, that it starts at birth, and of course beyond that in the mother's sort of her nutrition during gestation. But the point is that it is the most important factor on how the brain develops, and yet we do not we were thinking about it as a curative rather than a preventive. And I think that shift, if it actually comes in, we're all like holding on to a horse that's going to ride. You're moving on to you, Ishi. You actually do practice a lot of the therapies as well, and help people in working with them on a day-to-day basis as well. So what are some of the in your area of work? What do you think are some of the challenges to actually habit changing, especially for people with diabetes? I know I live with somebody who has diabetes, and it's like we're policing the whole time, and I know that people want to change, but I think their taste buds override their intellect. I would love you to share your point of view on curbing the onset and the not the onset but the magnification of NCDs. You're on mute. Thank you.
First of all, thank you for having me. And some very important points have been made by the previous speakers. And really, I want you all to know that we really know a lot more than we ever did in terms of knowledge, in terms of the data, research. There is so much more today available to us as health practitioners and as people, as populations, like never before. Whether it's food, whether it's nutrition, and whether it's just basically information on how to live, we are far better informed. And even if it's kids, I think kids are better informed. The other aspect is about food. We are not short of food. So we have enough food, we have surplus food. Of course, there are issues regarding distribution, etc., etc. But what I'm trying to make an important point is here about the fact that there is still, despite the knowledge, despite the abundance, we are still battling non-communicable diseases and malnutrition at levels which we have no business to be. Whether it is iron deficiency, whether it is B12 deficiency, whether it's vitamin D deficiency. We are in a land of sunshine. We have no dearth of vitamin D, yet every other person or every person one checks is grossly, critically deficient in vitamin D. And despite iron prevention of anemia programs, crores of rupees have been spent by the government, but yet anemia continues to remain at the same figure, whether it's children or whether it's women. So these are very important areas. And when it comes to regulation of eating, how much to eat, like you rightly said, we cannot be policing each other. We cannot be making food a war, a tussle of your willpower all the time. I want to eat this, but I can't eat it, or I should not be eating it. We cannot be living in guilt. Where has it all gone wrong? Were we supposed to eat like that? Do animals in the wild suffer from obesity? Chimpanzees, which are the closest to human beings in terms of their genetics, don't have cancer. And yet the pets that we keep in our homes, our dogs, our cats, they seem to be suffering from similar diseases as human beings, as the masters eat. The masters have, whether it's diabetes, obesity, arthritis, thyroid, all of these seemingly have crept into their lives. So something is needing to be looked at differently. Where we are going wrong. Why aren't we able to regulate our food? The pet who's constantly hungry, but the dog outside is not. There is a loss of regulation. There is, let me put it this way. We all have checks and balances. Even the baby who's born has innate checks and balances on when to stop eating, or when the mother cannot force a drop of milk extra to a baby if the baby decides not to have. And I don't think that's disputable. We all know when to stop. But when we eat wrong, when there is inflammation of the system, our checks and balances begin to fall apart. And I see that in my practice all the time. So when in my practice, I deal with inflammation, why I change the diet to an anti-inflammatory diet, I see absolute transformations. And this is real. And it's transformations not only in terms of how much the person is eating, but in terms of their numbers, whether it's a diabetic, whether it's whether it's heart disease, whether it is cholesterol, hypertension, or mental health, depression, or whether it's autoimmunity, thyroid levels, they seem to normalize with the right diet. Diabetics who are on insulin seem to have, just within few months, they're off insulin. And I'm not talking of one patient, it is every patient. And I don't know whether this forum is the right forum to talk about this, but yes, it's important to know that we are treating type 1 diabetics who are totally insulin dependent. That's the way they are treated. We are managing them free of insulin just by managing their diet. And these are real hardcore examples to support the fact that we are missing issues. We need to join the dots. And today we are in a position to do it. So yes, it's mental health, it's physical health, it's what you eat, how much you eat, when you eat, but it all need not be so complex. We've made it very complex. But if you go back to our ancient practitioners of health, whether it was Ayurveda or whether it is Hippocrates, they said all diseases begin in the gut. The ancient system of our Ayurveda says, Jaisa an vaisa man. They all seem to be so profound and so applicable to what we are seeing today. So if we are able to address these simple issues and we're able to accept them, recognize them, accept them, I think that's all that's needed to correct right from malnutrition to overnutrition. And having said that, I want to also make an important point here that even those who come to me as patients of obesity, who have abundance and are overeating, they suffer from critical levels of malnutrition, whether it's vitamin B12, iron, micronutrient malnutrition is rampant in the obese. So I think I'm going to leave it at this point that we need to join the dots. We need to understand that where are we missing the links, and that the two big issues that we need to address in our food system is inflammation and addiction. Why certain foods are addictive and how we can remove those foods, and how eating behavior can be modulated just by correcting these two issues. And I'm not oversimplifying these things. Of course, we need to do much more. We need to replenish the missing nutrients. We need to look at the gut health. And all of this, when I say all diseases begin in the gut, our gut is basically an organ in itself by the sheer number of microbiome, the gut flora. The importance of the gut flora today has been able to, explain so many things that we are suffering needlessly. How a disturbed gut flora, we call it dysbiosis. So all of this is, like I said, it can be so easily explained. And if we understand, literally, I would just end by saying, cure is in the cause. When we understand the cause, whether it is diabetes, whether it's heart disease, whether it's autoimmunity or cancer or malnutrition, the answers lie in just one single thing which is treating your gut. So, and like I said, in clinical practice, one is theory. If a woman who comes to me with 20 years of an antidepressant gets off her medication in 2-3 months, and this is not one woman, there are so many men and women who I'm treating just by addressing these simple issues. And so it's really not that complex. And here they have been told by their treating physicians that these are lifelong issues and they'll have to be on medicine forever. So that's the power of food, and that's the power of how food can really transform our lives.
Amazing. Thank you so much for sharing that. I think it would be so important, and we have two doctors here as well who actually do run clinics, but it's so important for even our GPs to understand food. Because I know that, when I get people who we take in therapy, they'll be like, we went to the doc and the doc said, we told them we were stressed and they prescribed us some medicine. But I'm like, but did they ask what you're eating? And did they ask, how you're sleeping? And none of those questions were really asked. And I find it like just goes against general knowledge. I mean, how can you not ask what the diet's like? How can you not ask what's being put in? How many hours? They have a gap? What are they really doing? PMS. We know PMS is driven by the severity, is driven by the lack of nutrients in our body, and our body is unable to cope with it, and therefore, there is a huge mental health burden that comes along with that at that point. But there's so many things. So I'm glad that you're talking about it. I wish all the doctors could do a workshop on it, because they might be able to ask the relevant questions then. And I know Dr. Sachin Bajaj, you're here. Thank you so much for being here again. And I know that in your practice, you obviously talk about nutrition, considering you've educated yourself in this space as well. How do you make sure that the changes are being implemented, and how are we actually measuring the changes within the patients that we see?
Thank you very much, Dr. Prakriti, for having me here, and thank you very much, Kamalji and the entire team at IHW Council for organizing this very, very important conclave. I think in the midst of the pandemic, we've all forgotten how dangerous NCDs are and how much they are contributing to the global burden of disease. I would wholeheartedly concur with what Dr. Preeta, Dr. Bhavna, and Ishi said before me. Perhaps not to the extent of going that diabetes 1 can be treated completely with diet. I haven't had any experience around that yet. But yeah, most of the other things, I think I agree with everybody that most of the things that are affecting us right now are being contributed by the nutritional deficiencies and excesses that we are subjecting our bodies to. I come here wearing many hats. So I am a diabetes care physician mostly. Most of my practice is centered around diabetes and hypertension and chronic diseases. But I also wear the hat of a hospital a chain promoter. We run 13 hospitals in various small towns of North India, and we are finding the prevalence of NCDs increasing dramatically. Every village that we go to, we hold a lot of outreach camps. Just because of this reason, we've increased our outreach camps frequency to almost now 40 a week. Every village we go to, with every camp, we'll find at least out of the 100 or 200 patients we'll see in the village, at least 5 or 6 completely new diabetics who have no idea that they've been diabetic, and their level of detection on first intervention is anywhere like 300, 400, their blood sugar levels. And it's quite scary on how the NCDs are increasing even in villages. We think of these diseases as of being of the rich and of being of the bigger cities. I also wear a hat of a parent, and I have a son who was born. When he was born, he was quite sick. So, and he was the first a male child in a Punjabi family, as we know how they are pampered. And when he finally reached home after his prolonged stay in the hospital, everybody was hell bent upon feeding him, and it was like he was wearing the clothes of a 6-year-old child when he was 1 year old. And that is when still very thankful to a pediatrician. So we were consulting our regular pediatrician, and he went on leave for two months to travel, and we met a new young pediatrician, and very thankful to her. She scolded us like anything. She was like, "What are you doing to your child?" And we forget that all these fat cells and adipose tissues are laid down in childhood, and then it's very difficult to reverse them, and that is why we have so much incidence of diabetes and obesity in the country, that we tend to pamper our children. And as Ishi said, the overeating and the oversupply of nutrition, it's just how different the distribution of food is. It's not like that the food is deficient, but the distribution is so different that it's very difficult to sustain all these issues. So thankfully, we had to put him on a diet when he was 1 year old, and then I started focusing on the nutritional issues of young children. And now, in as part of our diabetic practice, we have a big education session just for infants and toddlers on how not to, feed them rather than how to feed them, is the issue that we focus on a lot for all the children of all patients who come to us. So it's a issue that is very prevalent. I think we need to focus much more, as you also said, on the dietary part of it. Every new patient who comes to our center, I think we have almost like 40 to 50 minutes just on his daily schedule, what they are eating, what they are doing, what they're exercising about, even before they see the first doctor. So that, I think, is missing in a lot of clinical practices, which I feel has to be focused upon. As Dr. Bhavna also said, we need a lot of policy issues, and I think the wide bridge between that has to, I think, somewhere at least we should start constructing it, if not aim for having the whole of it.
True. That is true. I mean, talking about parents, I have 3 kids and I have one that's nice. He does everything correctly. And I have one who's just a nightmare. I mean, he will go for the junk cupboard the whole time. And of course, my husband says, why is there a junk cupboard? But for me it's not about like restricting, but about obviously educating them, giving them the sort of understanding, and then the odd treat here and there. But it's become difficult, and no matter how much I say, your fat cells are here to stay, buddy. If you carry on this way, that's what's going to happen. I'm helpless. So even though like we learned about this, and I've had doctors talk to him, I've taken him, scared him, like got the doctors to scare him. Luckily, he thinks he's fit. So it's difficult to get him to understand that it's not about how you're looking right now, but it's about what's happening inside. And it's going to start showing at some point. But as parents, I think we're fighting so many battles, just keeping them, happy, sane, normal, fit, in all different denominations of their life, that it becomes really difficult. So I can imagine what the government is up to, because we're only talking about one kid here. They're talking about a nation. So it is difficult. And so I'm going to move on.
Every second kid in India is deficient in some micronutrients, and 40% have stunting. So it's the child nutrition, I think, is a huge challenge to overcome. Government is doing a lot of things, but I don't think that's enough. We have to really take it to the community level, especially in terms of girls. I think twice as many adolescent girls are anemic as adolescent boys. So there is a lot of issue around adolescents, children, especially in the girl child, and I think it needs to be taken care of on a war footing.
Yeah. So going into my next question, thank you for that, Doctor. So we have Dr. Nikhil Kelkar. Thank you for joining us from Hexagon Nutrition. And I see because of some you promoting desirable foods as well, and adding nutrients as well. I'd like to really understand from the health promotion perspective, what are some of the what is the roadmap that you have planned, and how are we actually gonna sort of provide not only the education and the skills for good health, but going beyond that to habit formations.
Sure, sure. So thank you very much, Prakriti, and thank you very much to ISW Council for inviting me. The question is broad, and I will try to answer, it more in terms of clinical nutrition, because I'm from the field of clinical nutrition. So first of all, I want to wish everyone a happy nutrition month, or Poshan Ma, as we call it. And to understand clinical nutrition, we need to first understand what is medical nutrition therapy, or MNT. So the medical nutrition therapy is actually an adjuvant therapy to your medical treatment. And, it is via the use of a specifically tailored diet, which is devised and monitored by a medical doctor or physician and or a registered dietitian. So, clinical nutrition here, in simple terms, is a nutrition formulation which is designed to manage a disease or a health condition of a patient. And from my contribution to the roadmap, what you have asked me, I mean, this is one of the major aspects where we really need to create awareness amongst the general public. Because if you see, by and large, India's protein consumption survey of 2019 by the IMRB, it suggests that 73% of urban India is deficient in protein, and 93% are unaware about their daily protein consumption. And if we see our regular Indian plate, which we eat, it's more based on the carbs and less on the proteins, and that is a major factor. And when we are talking about non-communicable diseases, that's what that over an excess of carbs, later on it leads to things like non-alcoholic fatty liver disease, and progressing to metabolic syndrome, diabetes, and that's what we are talking about today. So this protein deficiency is very, very important aspect which we need to see by and large at an all India level, and it leads to a commonly known condition called as sarcopenia, which is in simple terms is loss of muscle mass. And it's not just very common in the elderly, but it is also in the younger age groups, and due to the faulty dietary habits basically. So if we see a normal, individual daily protein requirement, it is approximately 1 gram per kilogram body weight per day. So that means if you take an example of a person weighing say 60 kilograms, so that person has to consume about 60 grams of protein per day, which is approximately equivalent to 10 eggs per day, just for an example. So this is what it is, and with the excess of carbs, it's really affecting. And this protein requirement really increases much more in a patient who's suffering from a medical condition, who is hospitalized due to a particular disease specific condition. And as per the severity of the disease condition, for example, in cancer patients or in the ICU, this requirement of protein goes up to 1.2 to 2 kilogram gram per kilogram body weight per day. And then there is restriction of electrolytes like sodium, potassium, etc. If the person is a diabetic, the patient is a diabetic, simple sugars have to be avoided. So you need complex carbohydrates like maltodextrin or fructose as the source. And all in all, these specific nutrition requirements can be very well be catered by giving special nutrition formulas which are readily available, which can be easily reconstituted in water, and it can be given orally as well as if the patient is unable to eat, it can be given by tube feeding also. So whether it be it a diabetic formula for diabetes, or a renal formula for renal patients, or a hepatic formula for the liver patients, it is tailor made in such a way that the protein, carbs, and the micronutrients, whatever are required for that disease condition, it fits that. And this coronavirus pandemic has compelled us to rightly put health first, definitely, and we have realized much more that importance, and nutrition definitely plays an important role. And I feel that one of the best defenses against any such health risks like COVID-19 is to build a strong immunity, and which can happen through proper nutrition, because that's the first step. And obviously, a protein rich diet, which is very, very important. And as we have, increasingly changing in this pandemic, more to the snacking, more to the those kind of things which are high in fat and high in carbs. And I would also strongly recommend addition of soluble fiber to the diet on a daily basis, wherever it is available, wherever it is possible. And in the current situation of this pandemic, there is also a lot of demand for immuno enhancing formulas, or the immunonutrition as we call it. So all in all, lots of things are available. We need more awareness about it. And I think, quality of life can be definitely be. So all in all, I mean, I would end by saying that, let food be thy medicine, and it is very much possible with the help of clinical nutrition. Thank you.
Thank you. Is that a very large field at this
Uh,
point? Yeah.
Yeah, it is. It is growing, and as I said, it's this that awareness. That these therapies are really available, and we definitely have very good qualified dietitians in the country who provide these services also. And yes, but the awareness needs to be created. That such kind of formulations are available in the market. That is missing in more of the general population, I would say.
Yes. If I can just now ask a couple of questions, and you can decide who would like to answer. I think, Bhavna, this is more relevant to you, but you can decide. Like I said, if anybody wants to take it up. When we're talking about these healthy food habits, I know. I mean, I'm in Vancouver, and I remember when I was in school here as well. We were compelled to actually read labels and discuss what those labels really meant on food. I know that in India, when we have our food, we do not actually have labels that are, like if I buy rice, I don't really have a label that's telling me how much sugar is in that either. If I buy, if I buy my dals, I don't know what protein, how much of percentage of protein I have in a portion. I'm thinking from a policy point of view, would it be essential then to have those things started up so that people can understand what they're taking in?
Yeah, so I'll take that up, Prakriti. I think what you just pointed out about the label part, I think that is pretty much the heart of what we're all talking about. Because end of the day, you can have only so many people who can be part of a policy making process and even understand it for that matter. There are only so many people who are part of the actual innovation of a product development or industrializations and things like that. Label is something which goes to everyone, every single one, right? But there are two parts of it. So one is, what are the policies around the actual label today in India? And, so I am part of a certain, group. So I don't think I'm at the liberty of completely share it, but, we have progressed ahead. So if you see, with this whole percent DBs, which are part of, international labels everywhere, if you see, and there are different kind of labels which are now available, which are being either mandated or voluntary, if you see all across the globe. So whether they are the traffic light ones, or whether they are the healthy symbol ones, whether they are the smart choices ones, there is some cue which is present on a label for people to make an informed decision and a choice for the things that they would like to buy. It would not only tell them about exactly what's present in it, it would tell them about the amounts of it. And I think a lot of responsible labels would also have the frequency of consumption indicated in one way or the other in terms of portion guidance or portion control, whether through a method of preparation, whether through a scooper, whether through a single packaging unit within a multi-pack and things like that. In India, I think the government has been very actively, along with the industry, along with the experts in the field, have been discussing this. And I think very soon, so there is already a draft that is available. And I think very soon, probably that should get implemented about, what would be the uniform way of sharing nutrition information on the labels and all the products, packaged products, I mean here. What would it actually have per 100 gram per serve? What is going to be the percent RDA, which is the recommended daily allowances for certain key nutrients? Everything's going to be there. I think there's also a discussion which is happening about maybe a more graphic or a pictorial representation of it, which helps people to understand whether it's, how they can make it part of their balanced, diversified diet. So that is one part. So I think that policy part of it is definitely in a very, very advanced stage right now, and it's probably going to happen very soon. There is another challenge altogether in India, which is about the whole awareness education part of it, which is probably something which is, I won't say that should become a limiting factor to the policy that is already happening, because this is one way or the other. But yes, I mean, I think there was a research that actually was conducted, a year back, which said that, do people actually read labels, even when it is present by some of the organizations who are doing it voluntarily. People actually do not read labels. They don't turn even back of pack. And I tell you, I'm living this day in and day out. So even if I have to put out a claim on pack, my entire marketing team would say, put it in the front. Nobody turns back of pack. We really want to put the information back of pack. Nobody does that, right? Today, if you see, there are QR codes, there are scanners, there are pictures you take and just put it in the app and it'll tell you every single thing. You go out and it's going to be there. Are people actually using it? Not so much. People get bored like this. It's so much information present that, there are less of people who can decode it for them rather than the information just present on the pack. So there is a whole part of, people doing it, industry and other bodies doing it responsibly. Policies around it, for the people who don't accept it or challenge it back or don't believe in it and things like that. The whole other part, which is, I think, probably the 50%, if more, is that people able to understand it, absorb and adopt it, because that is what the important part of it, that's the soul of it. Because, even if they do read, one is education, literacy thing. So hence in India, I think a graphic or a picture or a symbol probably is more helpful, in addition to just writing probably, or in place of writing. That's still getting debated probably. But I think in that segment, some bit of work has to happen in parallel about, when it is saying this is what it means, and I think fundamentally, food, when we talk about it, of course, it plays a very critical part in nutrition, but it also plays a very important part in, that wholesome, joy, nourishing part of it. It's a softer aspect to it as well. So without losing that aspect and giving the information in the right way is something that is happening in India. And I think we are all wholeheartedly supporting that. We're working towards that. And I think a lot of us are probably part of one group or the other in a way. So that's happening. And I think that'd be good. And I think as we go ahead, the whole consumer education and engagement part, which has to happen again, like I said, with private and public initiatives together, is going to go a long way. Because that's going to help us, understand what am I eating, why am I eating, and how much am I eating. So that's the part of it.
Thank you so much. What I find fascinating is whenever we watch, whenever there's a celebration, there's a Cadbury chocolate, or whenever there's a celebration, there's a laddu, or something that's really unhealthy for you. I'm wondering if those kind of advertisements should be stopped at a policy level first. The government should just ban all this, because we promote unhealthy eating on every advert. Happiness, including our birthday parties, which are for kids, which means that you have to have a cake, you have to have those fries or like some unhealthy stuff, and you have to cater to this. So, I mean, I think as a system, if we were to adopt changes, even just this, I think like how you go to a movie and you see no smoking, smoking is dangerous. There's at least one text. When the laddu comes out, there should be another text that tells you this is really unhealthy and bad for you. Please do not indulge it, only for actors.
I think. No, I think Prakriti, I understand emotion. I think just to put it just a little differently would be to say that, I think if you just tell people, like we always used to say that, have sweets during celebration and not every day as a part of your meal. That brings a lot of positive joy, that brings some spark to the festivities. I think the problem happens when you're eating laddu 3 times a day, maybe. So I think, like I said, I think we do recognize that, food brings us joy, but it has to be responsible, both in communication from the people who are manufacturing it and from a consumer perspective on consumption. So I think it's a balance. So I think that is why it is tough. But
So, Dr. Bhavna, I would like to push back on that. Telling people you can have sweets with refined sugar during celebration is just like telling them you can smoke twice a day and no more. I truly feel sugar
no,
is
I
like,
think
I would not advise anybody to have refined sugar at all ever. So, I mean, the impact is quite horrendous.
Ishi, you had
no,
something to
I
say.
think
I
no.
just have a point of view on labels and a very practical one here. That while Dr. Bhavna is mentioning the importance of reading labels, and I personally believe in the importance of having labels and breakup of nutrients, etc. But one question may be just directed to her, that how many times as a nutritionist do you read a label and eat your food? Or how many times are you counting your calories every time you look at food? It is even the best of professionals. These are great adjuncts, they're great tools, but we cannot expect public health problems to get sorted out just by this. Even till today, we have apps, we have so many tools and trackers telling us how much we are exercising, how much we are eating in terms of calories, etc. But food goes way beyond that. And if it's not translating into obesity management, it's not translating into better health, there is a question mark there. I think for public health and for consumers, the important thing is to talk to people in the language. They eat food, they don't eat nutrients. So let's communicate food to them. Let's talk about importance of having so many fruits a day, or having so many vegetables a day, or having a handful of nuts a day, or the kind of cereals or the amount of cereals they should be having, because that's what they connect with. Look at the plate and say, let your plate be half a plate full of just vegetables, maybe the rainbow colored vegetables. And the balance can be divided into the proteins and the other foods that they have. So food groups is what they should be talked to rather than nutrients. Nutrient is difficult for an average person to do on a daily basis unless you are sick or in a nursing care. We don't eat nutrients. I mean, really, food is way beyond nutrients, is what I believe. It's about phytonutrients. It's about so many other immunoboosting, which we don't calculate. We don't have them on the label. So, and I see these kind of things in my practice. There is a woman who's eating a bar, who's a diabetic, which is full loaded with the wrong kind of carbohydrate, because the bar says it's rich in vitamin C. And she says, I'm a diabetic and the doctor has told me vitamin C is very important. So this bar is great for me, because she connects. So oversimplification and giving this to information to consumers who are half educated, I would say they're not even aware of these aspects, can tilt the balance towards just reducing, I would say, making wrong choices. So, oh, this is fat free, or this is sugar free, or this is this free. And, they sell their products. So just nutrition information is not enough. I think consumer behavior can change only when you talk to consumers in the language they understand and the food they eat. That's the point I was making.
Can I add to that?
Yes.
I think just a second. I just, because Isha, I think I completely agree with you, and I think that's exactly what I said. Just writing is probably 10% of it. You can only do as much as talking about it, because you also have to by the government policies. But like I said, being able to communicate, being able to tell, for them to understand, I think that's exactly what I said is the soul of it.
Yes.
People have to
it's very
understand
important.
it.
It's very important to have it. Yes.
Absolutely.
And particularly when today you're talking about allergens. Allergens are, allergies are going, they're out of the window. The rates at which food allergies are going up are really, so if people don't have that information on the label, it will be difficult for them to make choices. So don't get me wrong in saying that it's not important. It's very important, but I think to change human behavior or
it's extremely important.
Yeah.
Yeah. I think it's just sequential.
I'm unfortunately going to have to close. I think the next session is almost ready, and we've overshot it by 9 minutes. But it was lovely speaking with all of you, and your opinions and your expertise was really profound, and I'm sure will really help people who are going to be watching this. I mean, from the food environment to behavior and behavior change to the food system. I think we've covered all the realms that we needed to cover, especially given the topic that we had. So thank you very much for being here. And with sort of ending this, hopefully you all are following healthy diets yourself, and are, because we often talk about it but we don't follow it. So I suppose we have to be what we actually say, and do that to ourselves. So thank you very much.